You're listening to the La Jolla Cosmetic Podcast.
Welcome, everyone, to the La Jolla Cosmetic Podcast. I'm your hostess, Monique Ramsey, and today we're talking about protecting your laser investment. So I have here two guests with us, Julia and Cameron. Will you briefly introduce yourselves and your expertise? And we'll start with Julia.
Hi, everyone. It's good to be back. I'm Julie. I'm one of the PAs and one of the laser specialists. I've been working with lasers for almost a decade. It's one of my passions, and I do a ton of it here at La Jolla Cosmetic, and I work really closely with Cameron. You can introduce yourself, Cameron.
Thank you so much, Julia. Hi, my name is Cameron. I'm the esthetician here at LJC. I have been working here for about 8 years and have been in this industry since 2006, so for a long time. And I've always been on the medical side working with post-laser patients. So it's great working with Julia because she takes great care of her patients.
Wonderful. So today we're thinking about laser treatments. You know, it's an investment in yourself and an investment in your skin. Why do we think about it that way? And investment's a financial term, obviously. So how much money are we talking about when we spend money on laser treatments approximately?
Well, it can really range based on the type of laser and based on your consistency with the process. So I think, the way I think of lasers for a lot of people, it's like when you go to the dentist and you haven't been to the dentist in like 5 years, and you go in and you have a mouthful of cavities and they're like, you know what, you got to get all your cavities filled. It's that same concept. Your first time coming in, it might be a more aggressive laser that's recommended to really get you to that state of then being able to go on maintenance. And that's one of the things that's so important to understand about any of these things that we're doing. It's, you're investing in your skin, you're starting a process. It's not a one and done type of a thing for really anything in aesthetics. You're not going to come in one time. If you do, you're not going to get as much out of that one visit that you had. So when you come in, it can range from a mild skin laser, like something like BBL or V-beam. And the pricing is usually around $450 a session or so. And then, we get a glam fam discount included with that. But it can range into the $2,000 to $3,000 range if you're doing multiple lasers. And most often I'm recommending a couple different lasers your first session. And then that starts to dwindle down to how many you need to do in the subsequent sessions.
And the reason that there are different lasers, just briefly, is they target different things.
Yeah. So there's different lasers that target different types of issues with the skin. So lasers that target pigmentation only. Some are really good at targeting redness, like little broken capillaries, brown spots. Sometimes people even come in with a little sebaceous hyperplasia, like little raised spots on the skin, and we need to kind of plane those down. And then we move into, if needed, some textural improvements. So whether it's resurfacing with something like Halo or our really, really aggressive resurfacing, they all kind of work in different ways, but they work best together.
Uh-huh. Well, and that makes sense. If you're going to be laying on the table, do it all.
Exactly.
That's my theory. And I guess your cost does go up a little bit if you decide to do your neck. Like if you're doing your face or just around your eyes or your face and neck and chest or arms or hands.
Exactly. Honestly, it gets more affordable, I think, the more you do per area, because when you're starting, say, with a face and then you're adding areas, you're already there for the appointment. So the cost is a smaller amount to add different areas. And that's one thing Cameron, I see her recommend a lot to her patients to talk about. If you're treating only face up and then you're ignoring everything else, it really still shows your age. It's like, why even bother?
Cameron's nodding.
Yes. You oftentimes will see women with their face and their neck and décolleté look like their chest looks like two different decades. So it's all one, and we want it to all look the same. So I think it's best that way.
I think that it makes total sense because it's like if you paint the house and not the front door, or you paint the front door and not the house, like it's got to go all together. And I think also, Julia, your point about, the investment, to me, like the first thing that came to my mind is if you go to the hairdresser and you get your hair highlighted and you never ever go back, you'd be like, well, that was nice for that 3-month period, but then it grows out. And then, so it's like those kind of things that we think about doing kind of on a continual basis. And this is just not quite as frequent, right? So if you had laser this year, then do you usually recommend next year? Is it or every couple years, or how does it go?
I would say a typical plan is to do maybe a corrective series. So starting with like 3 treatments of something, spaced every 6 to 8 weeks. And then once to twice a year is pretty standard. The patients that I've seen, and Cameron can probably attest to this as well, when you're doing this as long as we have been doing this, you see patients over time and you see the ones that follow the plan and are consistent. And that every time they come in, their skin is glowing more and more and they're kind of aging backwards. And I see that with patients, all they've done, say over the past 5 years, is V-beam, which is a redness laser, but their pores are invisible and they don't really have wrinkles and their skin has this radiant glow. And it's because they're doing something that's causing a subtle, small amount of inflammation, which is in turn kickstarting collagen remodeling and just making their skin healthier. And so that's something that is not advertised on the billboards to do this and you're going to age backwards. But for people that do this for a living, we see that all the time, that if you're consistent with something, it's going to speak for itself.
And I would think, Cameron, being consistent, when you're not in that pre-post laser time, let's say within a few weeks or a month of having a laser treatment, but in between having either facials or the importance of their skincare products.
Skincare is so important. I always tell people it's so much of how your body looks is like what you eat, not necessarily the amount of exercise. But skincare is very important. When you don't do good skincare and you do all these treatments, it's like going to the dentist and not brushing your teeth in between. It really does help to enhance and maintain your laser results. So very important to be on the correct skincare, something that's going to work for you, but it's a really important part of the equation.
Can laser treatments also prevent maybe scarier things down the road, like skin cancers, Julia?
So that's a great question. It's a little bit of a tricky question. Lasers are not a replacement for skin checks by your dermatologist, skin cancer treatments that are designed to be skin cancer treatment. With that said, there is a theory that if you're just like with anything in your health, if you're healthier, if you have better skin health, if you're using the right skincare products, if you are staying out of the sun, if you're having lasers that are in turn making your skin healthier, taking away precancerous lesions, taking away brown spots that could down the line morph into something more. There is a school of thought of that, but that's not something that I would say laser is a cancer treatment, or if you think you're high risk, have laser. But it can definitely make your skin healthier, which in theory could reduce that.
So let's talk about how we might protect this investment into before the treatment, immediately after, and long term. So, Cameron, what do you and Julia, I'm assuming you guys work together to suggest what the patient ideally is doing prior to treatment?
One of the things that we want the patient to be using is something that's going to clear out the extracellular matrix. Basically, it's going to take all that debris out of that area so you get a better laser treatment. So using something like the Elastin Skin Nectar 2 weeks prior, or the TNS Advanced Plus Serum, it's going to prep your skin for it to get the best treatment. Also, using a retinol prior to, we stop 5 days prior to the laser, but it's going to, again, prep your skin. And oftentimes, and I know Julia is really great about doing this, if we're a skin type 4 or higher, we may recommend doing a hydroquinone so that you don't have any kind of post-inflammatory hyperpigmentation. So that's protecting your skin, because anytime that you traumatize the skin, if it's a skin type 4 through 6, you're going to get that post-inflammatory response. And we don't want that to happen. So we're really good about being on the same page with pre-treatments, just to make sure that you get the best treatment out there.
And Julia, can you talk a little bit about, like, if people haven't heard of their skin type 1 through 6, what does that mean? Skin type 4 through 6 might be who?
Yeah, so there's a scale that we use, and it starts with 1, ends with 6, the Fitzpatrick skin typing scale. And it basically, a good way to think of it is 1 is like the lightest, most fair skin type you've ever seen. 6 is the darkest. And, we as providers can assess based on your complexion, your ethnicity, how you respond to the sun, your eye color, your hair color, your skin tone, where you fall in that category. So somebody that's considered a 4 will be somebody that may be Hispanic, olive, a little darker complexion, tans when they go in the sun, doesn't usually burn. 5 would be, someone with even more melanin in the skin. It's basically how much melanin your skin produces. And the reason that's important with any sort of aesthetic treatment like peels, lasers, anything that's energy based is when, as Cameron mentioned, when you have that inflammation in the skin, that's part of what we're doing. We're causing a controlled inflammation. But as that inflammation calms down, you can get a little congregation of that melanin in the skin surface, and that can create a darkened pigment. So it can create a hyperpigmentation or what's called post-inflammatory hyperpigmentation. So it's really important, when we do your initial skincare consultation, when we're talking about what your plan is, I will recommend a timeline of using certain things before and after. And hydroquinone is one of them that most patients end up needing. Most patients, especially in Southern California, have a little bit of a tan, or, Americans always have a little something with olive skin, something with light skin, or kind of blends. So when we have that prep for the skin, then it makes it much lower risk to have that hyperpigmentation after the laser.
Now, does the prep, I guess if we talk about hydroquinone, does that bleach the skin, or what does it do? How does it work on the pigment?
Yeah, so it's actually inhibiting an enzyme that contributes to producing pigment. So I like to think of it, you have different pathways that your body produces melanin, and hydroquinone is like putting the brake on that pathway and stopping your body from being able to overproduce that pigment. So it's not something that's going to be bleaching or whitening or causing pigment loss in the skin, but it's going to stop your body from overproducing that melanin if it feels like it needs to from the inflammation.
Oh, got it. Okay, that makes total sense. It's one of those questions I've always wanted to know. So now I know. If I've been around and I don't know, we don't know unless you're using it. So I think that's a really interesting thing. So prior to treatment, we're going to pre-treat the skin, but then right after going home that night, and I'm sure maybe it changes depending on which laser you're having, but Julia, what does that look like for your patients?
It does depend based on what laser you're having. So for the non-ablative, there's kind of 2 classes of lasers, ablative and non-ablative. For non-ablative, it's a much more simple regimen. You're avoiding irritants, you're wearing your sunscreen. Typically, people can still wear makeup. They can, just be gentle on their skin for the first 3 to 5 days. If it's ablative, then that's a different ballgame, because there's certain things that we want you to use and certain things that we want you to avoid. And that list is a little bit more extensive. Usually with our patients, we'll give you a kit of all the products we want you to be using. So a really gentle cleanser, a really gentle moisturizer. Cameron mentioned the product Elastin Skin Nectar, which has been in the market now for maybe 5 years or so. Would you say, Cameron?
Yes.
And that's been a really nice option for pre and post laser. So I'll touch on that a little bit more with how it helps your healing. She mentioned, the clearing out the extracellular matrix. It basically helps your cells communicate better with each other. It's taking away some of that cleaved collagen debris and helping that clear out of your body and out of your skin, so that when you're healing and you have all this inflammation and trauma in the skin, you're able to heal faster and better. So we use that as a pre-treatment for 2 weeks before a laser. And then we have patients usually put that on as they're healing. And that is going to help with their healing process. Also, I'll use a topical moisturizer, and in some cases, a laser balm, which is just like a little thicker ointment if they're having a deep laser. So the deepest laser that we do is called Contour TRL. That is usually involving laser balm, vinegar soaks, which help promote wound healing and keep that wound bed clean. And then you can transition onto more lightweight products once your skin is considered re-epithelialized. So once that surface layers come back and it's more intact, then you can move back to more regular products.
So you were talking about a non-ablative laser.
Mm-hmm.
So what would be an example of a non-ablative laser where the post-care, like the one where you're saying you could wear makeup or wear?
Our 2 most common that I do and all the laser specialists at the clinic do are called the V-Beam Perfecta and Broadband Light, or BBL. So most people have a mixture of either red or brown pigment in their skin. So non-ablative devices like the V-Beam and BBL help pull that out. They work on detecting the hemoglobin in your blood, those little capillaries that are kind of pooling, and kind of tone that down, or they look for the melanin in the sun damage and pull that out. So those are the 2 most common.
So then the patients come back, let's say a couple weeks after their laser. And then what happens next, Julia?
Well, when they come back for their follow-up, we do a follow-up with the provider. And then we also If they have not yet met with our esthetician, typically Cameron is the person that sees all the post-laser patients, and they will meet with her for a post-laser hydration treatment. And so that is an opportunity for her to kind of assess their skin as well and kind of build that relationship that's going to be the long-term relationship with maintaining the result that they get from the laser.
So, Cameron, tell us what that post hydration facial is. What does that do?
So we call it a post-laser hydration treatment. And so people come in and we take photos because we want to see how they've healed and just make sure that everything's going well. They come in this is a great time for them to kind of reassess what they're using. So it's a great opportunity for them to bring in their skincare that they were using prior to the laser so we can fill in the gap, so to speak. So when we do the post-laser hydration treatment, we're not really touching the skin too much because it's usually been maybe a week and a half to 2 weeks post-laser. So you don't want to overwork the skin. So we simply would be using a hydrating serum, and then we use a calming mask to calm that redness and just to kind of heal that skin a bit. And we use the steam to just really help it to penetrate into the skin. At that point, I go over what their skincare protocol would be from that point on and how to best maximize their results. And so by using the correct skincare that's going to get them the results that they want, we may introduce things slowly. And then typically what will happen is that patients will come back at the 2-month mark post laser. Oftentimes they'll come in to see me for a medical grade treatment facial and be able to take those photos and really kind of reassess with the provider, where do we want to go from here? Have we achieved the goal that we want? Are we wanting to move forward or what have you? Because I think what people don't realize is that the skin is the long game. It's not the short game. So we're here to walk you through that and, make a plan that's going to work for you, for your budget, one that's going to work for your time, and that's going to get you the best results in what you need.
Yeah. And really talking about that investment working, it's like you're going to pay a certain amount for that laser treatment, but then, like you say, what happens afterwards? And I think that people don't really realize that sometimes the cost of the product, and if you go to Sephora, you go to a store like that, some of those things are like really expensive and they're not really going to help you. And so all the products that we have been tested and studied and we know, and that's where Cameron really can come in to help you. Let's say, okay, what's your biggest goal? What's your biggest concern about your skin? And let's prioritize which products are going to help you get there. What would you say, Cameron, is the biggest concern that people have either at that post hydration appointment or after?
Post hydration, they're feeling red, they have a lot of erythema, or they're feeling very dry.
Wait, what's erythema?
Erythema is just redness. They just, again, it's post laser. So that's very normal. I think that what happens too is that your skin flushes a lot more easily. And that's something that happens post laser and it takes time and that will get better. But again, these are all very normal things. And I think that with them coming in to see us post laser, it just really helps them to know that you're exactly where you need to be. We're going to get you on the right skincare that's going to help you heal and go from there.
So, what do people need to avoid before a laser treatment, Julia?
Well, a rule of thumb is just anything that might irritate your skin. So things that normally if you put on, you might feel a little bit of a burn or it might be kind of sensitizing, such as retinols, glycolic acid, salicylic acid, even the hydroquinone. I typically have patients stop it for a few days before, depending on the type of laser, the range of that can vary. But you want your skin to be calm. You want it to be tolerant to the energy that we're about to put into it and not already at a limit with irritation and inflammation and then putting that energy into it. Similarly to if you were going to be going in the sun, you'd want your skin to feel calm. You wouldn't want it to already be red or peely or irritated. So those are the main things to avoid right before. Sun exposure is important in the weeks prior to any type of laser. So that's something that when we do your consultation, we talk about avoiding spray tan, sun exposure, anything like that, at least 2 weeks prior. And then the few days prior, kind of scaling down your skincare regimen to simplify it and make sure that it's very gentle.
Spray tan. I forgot about spray tans. Is that a big thing?
A lot of people forget about spray tans.
Yeah.
It's staining the skin basically. And so when you come in, a lot of the way these lasers work is they have a target they're looking for. And so if your target is pigment and then you have an artificial layer of pigment in your skin, guess what? Energy is going to go right there. It's going to burn your skin. It's going to cause a bad reaction. So it's a big no-no.
Oh, interesting. I never would have thought of that, but that's because I don't go spray tanning. But, it's true though, here in Southern California. I mean, it's certainly a spray tan is better than sunbathing with SPF 4, but like we all used to, or nothing, baby oil. Now, are there any medications that people have to stop or worry about taking around a treatment like this?
Yes. So usually we'll do a full screening of that as well. In general, things that might suppress your immune system. So if there's any sort of systemic medications that people are taking long term, that discussion will happen of why you're on it, if it's a good idea for you to even have laser, if it's something that you're taking long term, because if you're impairing your wound healing ability, then you're not going to heal as predictably from a laser procedure.
Oh.
Other things to consider are oral photosensitizing medications, like certain antibiotics can make you more susceptible to reacting or burning from a laser. Those are the main things. I usually advise to avoid things like blood thinners, similar to injections, just because that can affect your healing, your bleeding during the laser, your bruising from the laser. Usually those aren't hard and fast rules. It just means you might bleed more, you might bruise more. But certain medications, like antibiotics that increase your photosensitivity, that would be something we would want to, avoid treating while you're using those.
All of a sudden, I just thought about birth control. Is birth control something that you guys have to worry about or not really?
No, birth control is okay. The main consideration I would say for hormones is postpartum. So pregnant women and maybe the first 3 months postpartum, or if you're continuing to breastfeed, you're in a little bit more of a hyperpigmented state. So anyone that has pregnant, you probably notice that you get pigmentation in areas you never had it before. You can get melasma or hormonal pigment on your face. So it just kind of throws a variable into that. I'll usually have patients wait until at least 2 to 3 months after they stop breastfeeding if they're going to be doing an aggressive laser or they're more olive tone, just because it can take that long for that pigment to regulate.
Now, Cameron, can you think of any patients' stories where, you're seeing people all day, every day who've had all kinds of treatments where this kind of collaborative approach with the provider helped help the patient?
Well, Julia said it right there. You do see patients that have seen all of us who get laser on a regular basis. They have been using skincare, on a regular basis. They get all the injectables. They may do PDO threads or what have you. And those patients, when they come in, literally everyone says, "Oh my goodness, their skin is beautiful." But they do everything, and it shows. So there are things that I, as an esthetician, cannot do. And I need to have my other providers like Julia. And we all just work so well together to get our patients the best result. And just to have a patient turn around and say, no one has ever given me compliments on my skin. And I'm getting compliments on my skin now. It's just wonderful.
Well, and that's the largest organ in our body. We're showing it off all the time, good or bad. So, it really makes sense that you look at it as a lifetime commitment and with people who you can trust to say, okay, yeah, you know what, you can skip this session. You're looking good, or let's double up something because you've got a wedding coming up or you've got a life event. I think that's something that not everybody always thinks about until it's too late. If you have a big life event, a reunion, a wedding, something that you want to get ready for, and if it's 6 months wait, it's okay. You can start now and start looking good. You're not going to wait till the very last minute to really be able to get the best result.
You'd be very surprised, though, the people who are consistent about it, anything can come up and they're going to look fabulous.
Well, I'm sold. I can never get in with Cameron. She's so busy. She doesn't have time for the rest of us. It's very sad.
No, it's so fun. Every time I see one of my laser patients in the lobby and, I know that they were just there to see Cameron and I'm looking at them. I'm like, "You're glowing. You just saw Cameron, didn't you?"
We're all jealous.
But it's just when you're consistent with anything. And I think that people understand this with exercise, right? If you get to your goal and if you stop, you're going to lose it all. It's the same thing with skin, but we live in an instant gratification kind of society. And that is not the way that it works. So I think that places, I love working at LJC with providers like Julia because we're all about the truth. And I think it's really important to know that.
Yeah, that's a great point because the instant gratification part, some things take 6 or 8 weeks to start working, but then boom, all of a sudden, so you can't give up because you're just not going to see the result. And whether that's Latisse or whether that's Nutrafol for your hair or whether that's the TNS Advanced Plus serum, things take some time, but then there's a big payoff. So thanks everybody, Julia and Cameron, for your expertise today. And I love the fact that you guys work together to give the patient the best possible result and maintaining that result over time. And that's the key, not just looking great next week, but looking great in 6 months and beyond. So for anybody who has questions about the different lasers, there's a lot of good information on our website about lasers. And we also have done a podcast or 2 about lasers. And so you can learn all kinds of fabulous tidbits. And then also we have payment plans for non-surgical services, which a lot of people don't know that if you're doing something a little bit either more aggressive or more body parts that you're adding and you want to have it now, but not have to pay for all of it today, then there's some different interest-free plans, and it really makes it affordable. And so you can get what you want and spread out the payments. So there's some information about that on the website. And then now, do you guys do virtual consultations?
Yes, we both do virtual consultations. And it's a really great way to develop a treatment plan. We can see, the skin really well, usually with the photos that are sent in, and then we do a video consult over Zoom. And it's been working really well for the past couple of years.
Oh, good. So if you're listening today and you want to schedule a consultation, head to ljcsc.com or give us a call or send us a text. And we've got all that information in the show notes. And then if you love our podcast, we would love for you to write a review of our show on Apple Podcasts or Good Pods or Spotify or wherever you're listening. We love having reviews. So we want to get better and we want to know the types of content that you want to hear about. So thank you both for such a fascinating little afternoon. And I will let you get back to your patients, but thanks for joining us.
Thank you. Have a wonderful afternoon. Thank you. Bye.
Bye.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code podcast to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Zymed building on the Scripps Memorial Hospital campus. To learn more, go to ljcsc.com or follow the team on Instagram at ljcsc. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.